Today we're going to talk about a rare condition, but it can happen, and I actually have a patient who recently was diagnosed with it. That's Guillain-Barré Syndrome. It's an autoimmune disorder where the body actually attacks the nerves, specifically the myelin sheath around the nerve that protects it. There is no cure, only treatments for it. And some of those treatments actually do produce really good results where you have a recovery and hopefully a full recovery with it. What it generally starts out with is weakness and tingling in the feet and the hands. That's generally the first symptoms. But be aware, there are a lot of times that you will see tingling like that is not associated with this but something else. Basically from there, it will move up into the arms, into the legs, causing weakness, and your muscles will not react like they should. It can lead to paralysis as well, but the paralysis isn't necessarily permanent. That's why it's very important, if you're experiencing any of these symptoms, that you get in to see your doctor and you can be tested for it. Because the sooner you get tested, the sooner you get treated, the more rapidly you can go and recover from this. Again, it's very rare. You really don't see it in kids very much at all. However, in kids, if they do get it, they will recover better and faster than adults. It's of an unknown cause, but 2/3 of patients who get it have actually had a serious infection in the last 2 months. Stuff like a serious case of influenza, COVID-19, hepatitis, things like this, where you really got sick and got knocked out. The other thing that can cause it would be something like trauma or surgery, if you had something like that. Then there are other few weird items. Cancer, if you're going through cancer treatment, you can see it as well. Now, from the tingling and weakness that occurs, you will see things like pins and needles throughout the skin, that same kind of tingling that goes on. Weakness that will travel up the arm, up the leg, and then total muscle, you'll lose your muscle reactivity, where you will lose your ability to stand without having issues with your mobility, without having issues with your balance, things like that. Sometimes you can see facial issues where you'll have trouble swallowing, you could have trouble breathing, you'll have trouble speaking. Double vision is also something that generally occurs with it as well. Severe pain, which happens throughout the day, but generally at night you're going to see more of it. A rapid heart rate can occur. And then blood pressure fluctuations, which can be, if you're normally low, you can go high. If you're normally in the higher range, you could drop low. And then the other thing, like I said, the trouble breathing is kind of a twofold. The muscle weakness in the face can do that, and then muscle weakness in the chest. So if you're having trouble with that, you want to make sure you get in to see your provider, because there are things they can do. Now, with all of these symptoms, something that you really want to watch out for, because it can lead to death, is blood clots, because that can occur with this symptom as well, or this condition as well. So you want to get in right away, because they can treat you with blood thinners to help out with that. There are several types of Guillain-Barré syndrome out there, but there are basically 3 main ones, and only one is seen in North America, and that's in acute inflammatory demyelinating polyreticular neuropathy is the big word. And that's the one that's predominantly in North America. There are other ones in Europe and Asia, but that's the main one. All ages can be affected by it. Mainly it's seen it, or not mainly, but there are more women that are affected than men. Now, as far as treatments, I mentioned that there's no cure, but the treatments that you can do. There's immunoglobulin therapy, where they will put in donor immunoglobulin in you. And what they're hoping with that is that the good antibodies in that immunoglobulin will knock out the bad antibodies in your own body that's attacking the myelin sheath. The other one is plasma exchange, where they will take someone else's plasma and put it into your body. That is hoping to decrease the antibodies that are encouraging the attack on your own nervous system. So if they can decrease the amount of antibodies doing that, they can decrease the immune response and hopefully that's going to take away the syndrome. Now, as far as drugs that will help out with your treatment, they're looking at, of course, at blood thinners to help with the blood clots, pain medications, and particular with that, they would look at things for neuropathy. So drugs like duloxetine, nortriptyline to help with the neuropathy, as well as depression that may be occurring because of what you're going through. Then you'll also look at physical therapy and occupational therapy to help you regain that muscle strength that you've lost. Now, when you're recovering, again, kids recover way faster, but for adults, 80% of patients will be able to walk independently on their own within 6 months. Again, PT and OT is a big part of that. Another 60% will recover fully in a year where they're back to their normal self, which is great. But again, you need to remember to see your PT and OT with that and continue on your anti-blood clot medication as well. Unfortunately, for the 5 to 10% left over, that's going to be a delayed or incomplete response. Again, physical therapy and occupational can continue to help you regain your muscle structure back and to live a normal life with this.